I'm here at Walsh Urology in Rancho Mirage, joined by Dr. Gary Leifer, urologist here. How are you?
Great.
Thank you so much for having us.
Thank you. We appreciate it.
Oh, of course. We're going to talk about some very important stuff, so men and women, listen closely. So what are some common urinary conditions that you treat for both men and women here?
I think probably the most common problems we deal with in men are issues related to their prostate. So elevated PSAs as an indication for possible prostate cancer, trouble emptying their bladder, etc. And in women, probably the most common issue is incontinence.
Okay, gotcha. So for some of us who don't quite know what a urologist does, can you give us just a rough, quick answer?
Sure. We run the mix. We do a lot of medical issues and we also do surgery. So we do everything from treating prostate cancer surgically to helping patients with medications for bladder control, managing sexual dysfunction. So really a pretty wide variety of issues are covered by the urologist.
Gotcha. Okay. So as far as symptoms go, what are some symptoms that both men and women should be looking for?
I think the most troubling symptom would be blood in the urine. So anytime somebody sees visible blood in the urine, it's really an indication for a rapid visit to the urologist because we're worried about tumors, stones, etc. So that would probably be the most alarming feature. I think the other things that typically bring patients in for men is if they're noticing significant change in how they urinate. That's probably a marker for a visit as well. And women oftentimes has bladder control problems that trigger the urge for a visit with us.
Blood in your urine, though, I would think that would be a real red flag.
It really is, because we're obviously worried about kidney tumors or bladder cancer or kidney stones. Those would be the three most common causes. So especially in someone who has a history of smoking cigarettes, that group we have to be particularly diligent about.
Interesting. I never knew that. Okay, so tell me a bit about a person talking to their doctor about urinary health. Do you think people are actually aware?
You know, I think awareness has improved in the last couple of decades. I think for a long time, patients just sort of expected all these problems as a product of aging. They had trouble emptying their bladder, etc. I think now we have so many things that we can help patients and improve their quality of life that it's been better recognized and they're more likely to come forward and discuss these issues with us. Sometimes these issues can be a hallmark of a more serious condition, so when patients are experiencing them, it's obviously worthwhile pursuing them.
Okay, all right. Let's talk about treatment for a moment.
Okay.
Give me an example. How would you treat, say, an overactive bladder?
Well, we usually start with medication. There's some very effective pills out there that are work quite well in managing the symptoms, and there's some brand new ones that have very few side effects and are very safe, and so that's really kind of changed our treatment spectrum a little bit. But for patients that don't respond easily to medication, we have some very effective new things to offer them. And those include either, you can actually do a nerve stimulation procedure here in the office, which is an outpatient procedure, painless, easy to do. We also do Botox injections, which is probably a novel use for Botox for most patients. But just like it relaxes the muscles in the face, it also relaxes the muscles in the bladder. And it's extremely effective in patients that don't respond well to medication.
So Botox used for something that is non-cosmetic?
Absolutely. It is FDA.
Who would have thought?
Who would have thought? It's FDA approved, and obviously I get all the patients say, well, if you have any left over, can we can we use it for another? Exactly. Can we go for a different location?
Right.
But it's the same drug, and it works by the same principle, and it really is very effective for the hard to treat patients.
Yeah, yeah. The future of urology. All right. Well, I appreciate your time, doctor. I really do. You can find Dr. Gary Leifer here at Walsh Urology at Rancho Mirage. Find him online at walshurology.com. Very simple. And thanks for joining us. We'll see you after the break.